What happens when a person has both borderline personality disorder and antisocial personality disorder? People assume these two diagnoses would somehow cancel each other out. It's not an off-the-wall thought if you really break it down. They think the overabundance of emotional empathy in BPD would soften the cold, callous detachment of ASPD. But clinically, the reality is far more volatile. So to understand this intersection, we have to look at the two types of empathy. Cognitive empathy, which is the intellectual ability to map what someone else is thinking, and affective empathy, which is the emotional capacity to actually feel what they are feeling. In a comorbid ASPD plus BPD presentation, the baseline capacity for genuine pro-social affective empathy is largely overridden by ASPD. But the extreme emotional hypersensitivity of BPD fundamentally alters how that deficit plays out in real life. So the first major dynamic is the structural weaponization of hyper-attunement. So individuals with BPD possess an incredibly sharp tracking system for nonverbal cues, micro-expressions, and shifts in interpersonal distance. Originally developed as a survival mechanism against abandonment, which we've discussed. Now, when you pair that hypersensitive radar with ASPD, it gets stripped of its relational care. They often retain a flawless, highly accurate radar for your emotional vulnerabilities, but they use that data with the cold transactional execution of ASPD, utilizing your weakness for immediate leverage instead of reassurance. Second, it creates a profound relational oscillation between split attachment and cold detachment. So during the BPD state, they can become intensely, explosively attached to a partner, drowning in a chaotic storm of panic, rage, and rejection-sensitive noise. But the moment they feel slighted or hyperstimulated by that stress, the callous defense mechanisms of ASPD can take over. They can abruptly flip a switch, severing the emotional line completely and treating the previously idealized partner with ruthless indifference, exploitation, even instrumental cruelty. And finally, there's a catastrophic collapse in the ability to mentalize, meaning they can no longer accurately interpret motives. When a purely borderline individual misrepresents a cue as abandonment, their emotional noise usually turns inward, resulting in self-harm or deep shame. But when a comorbid ASPD plus BPD individual experiences that same agonizing panic, they externalize it instantly. The panic feels like an intolerable threat to their autonomy or a humiliation. Because the ASPD traits block any vicarious pain for the other person's distress, they will use immediate behavioral control, severe manipulation, or externalized violence to forcefully quiet their own internal storm. They don't find a peaceful middle ground generally. They live in the erratic, high-volume internal chaos of BPD while executing behaviors with the unconstrained, outcome-oriented coldness of ASPD. It makes the interpersonal landscape highly unstable, as you might imagine. So if you want to understand the true neurobiological and psychological mechanics behind complex personality pathology like this, make sure to follow along. And let's talk about it in the comments.